Welcome, everyone. Today, we are conducting another podcast with Dr. Hina Jawaid, who is Associate Professor, Health Services Academy in Pakistan, in the Department of Family Medicine. Our topic today would be cervical cancer. Welcome, Dr. Hina.
Thank you very much for having me. Yeah.
So we'll start by asking one very common question, which is what makes cervical cancer such a significant public health concern in South Asia compared to other regions?
Right. Cervical cancer is an interesting cancer in a way that it takes many years to develop. And as a result of this one thing associated with this cancer, which isn't with many cancers, makes it more easily detectable, provided the screening modalities and the screening methods are available and the population is aware of it. Um, so I think that is why it is unique in many ways. It's a slow growing. There are a number of changes that can be identified prior to it becoming a full blown cancer. So, but the thing is, we need to have that group of females in a certain age group. For instance, the age group in which we should be offering the screening is from the age of 25 years to up to 44 years. Every 3 years screening can be done, and anybody who's 45 and above, say up to 60 years of age, the screening can be increased to 5 yearly. So the reproductive age group, let's put it that way, the 25 to 44, although the reproductive age group is a bit wider than that, but for screening purposes, this particular age group must be targeted. Pakistani women in this age group must be screened for cervical cancer for early detection to reduce any risk of deaths and morbidity because of it. Yeah.
So, in your practice as a general practitioner, what are the most common barriers your patients face when getting regular cervical cancer screening?
First of all, I think there is a huge lack of awareness, not only among the patient population, but in the practitioners population as well, um, particularly the general practitioners, the family physicians. Um, we maybe also there is a cultural barrier because we are not very comfortable talking about it, and I'm talking of both sides. Sorry, not just the patient, but the practicing physicians as well.
Mhm.
So maybe having information leaflets in local languages, or when patients are in the waiting room, having some information if they have got like a screen on which patients can read and inquire from the doctor when they come inside and see the doctor. Um, Lack of access to healthcare, particularly in the rural setting, where it's not easy for a female to navigate the healthcare system and be able to reach a qualified trained practitioner. Cultural barriers are there, things are not easily talked about. Um, the shyness also is part of it. And there are obviously misconceptions about cervical cancer as well, about what causes it, the
Mhm.
fear factor associated with it, particularly with the traditional healers. A
Right.
large number of our population goes there. So these are some of the barriers that we come across when dealing with it.
So, what are the common signs and symptoms of cervical cancer?
Okay. Before we move on to the signs and symptoms, which I'll talk in detail, I would like to just touch base with the risk factors. So,
Mhm.
because our podcasts are for educational purposes
Yeah.
and for development of continuous professional development of our general practitioners. So, if we are aware which is the high risk population,
Yeah.
then we'll be able to kind of promote screening and make them aware of the signs and symptoms as well.
Mhm.
So, smoking is a risk factor. It's not only cigarette smoking; it's hookah, shisha, and the tobacco smoking. So, and it's common even in rural population. in the younger college university going females. So we all know these practices exist, so it's better to ask.
Mhm.
Um, Somebody with HIV is at risk of developing a cervical cancer.
Okay.
Somebody who's married early and the age of intercourse was much earlier, um, in their teens.
Mhm.
Age, if they become parent at a very young age, if a female had a first pregnancy at a very young age, then because the reason for both of these is um, metaplasia, which are certain changes within the cells that happen in the cervical epithelium. They are more likely to develop at that stage.
Right.
Yeah, if you have a number of children, a high parity, five plus or more, um, any female with multiple sexual partners, or she's in a relationship where the male partner has multiple sexual partners.
Okay.
Low socioeconomic status. We don't know why it causes, but probably due to nutritional deficiencies, say vitamin A deficiency. And we all know vitamin A deficiency is associated with a lot of epithelial changes as well. So maybe it is linked to it.
Mhm.
So these are some of the risk factors. Now, in terms of the signs and symptoms, um, every individual is different. So, not like vaginal discharge is one of the symptom, but not every female would present with it. And the amount of discharge again varies. It can be intermittent, it can be continuous, it can be abnormal bleeding, like bleeding in between the periods, bleeding after intercourse, bleeding after passing urine, bleeding after passing stools. So you
Mhm.
have to be very careful in asking where is the blood coming from, right? Um, so, um, so if it's vaginal bleeding, and if it's an abnormal vaginal bleeding, then you go through that checklist of risk factors and see if any of those are present, and then you can uh, pain during intercourse, pain during urination, passing urine. Sometimes there is blood in the urine as well, which we call
Mhm.
as painless hematuria or blood in the urine.
Mhm.
They can be factors associated with bladder or the urethra, but do bear in mind that cervical cancer, because of the close proximity of the reproductive tract with the urinary tract,
Mhm.
and sometimes urinary frequency without having any UTI, without having diabetes, without having prolapse, without anything else. So just bear in mind, these are some of the red flags. Um, or any painless, fresh bleeding from the back passage, rectal bleeding,
Mhm.
changes in the bowel habits, because cervix is in close proximity in front with the bladder and behind with the rectum, anal canal. So
Yeah.
if there's something growing, it can put pressure on both these structures, anteriorly and posteriorly. Then in the late symptoms of cervical cancer could be swelling in the legs, or edema, what we call it, pitting edema. When you press the leg, you develop a
Mhm.
tight depression. Um, Kidney problems, any pain in the lower abdomen, which we call as pelvic pain, chronic pelvic pain or discomfort can develop. So these are some, again, weight loss. Some people get low back pain as well as a result of it. So these are some of the features linked with cancer, cervical
Okay.
cancer.
When you're talking about risk factors, you were saying women who have intercourse with men who have multiple partners. So why is
Mhm.
that risk there?
Mhm. Okay. Uh, you mean when
So they were
sexual
associated.
partner with multiple sexual
Yeah, yeah,
partners?
yeah.
Okay, because of the risk of transmission of the human papilloma virus.
Okay.
Now, HPV virus is of several types. There are numbers linked with it, like 6, 8, 16,
Mm-hmm.
18,
Mm-hmm.
33.
Mm-hmm.
So the risk of transmission of the human papilloma virus is higher. And the high risk HPV, the virus types are 16, 18, and 33.
Yeah.
Um, so, yeah.
Okay. Um, so in your clinical practice, what changes have you seen in cervical cancer screening and prevention methods over your years of practice?
the first response to this question is not a huge, but however, saying that, a lot of talk about cervical cancer is taking place in the medical fraternity already. It is happening at a policy making level, but the trickle down effect into the discussions transformed into action is yet to take place. Um, as you know, that our health care system and the GDP linked to it is not that large enough to see rapid changes in it. So I think there is work in progress. There is slow and steady things are happening, but has the screening reached the ordinary population in a rural area? That is yet to come. And I think while we are in the process, the one thing that we can accelerate is the awareness. And in order to make the local population aware, that that particular reproductive age group, females aware, awareness of primary care physician is crucial. So I think that this time must be utilized in making them aware. Every general practitioner must be equipped with the the relevant knowledge, the adequate knowledge that is needed to prevent such cancers. Yeah.
Okay, so that's very interesting. You also before said that your patients are shy or hesitant, and so are the general practitioners. So how do you approach conversation about the vaccination with patients and families who are hesitant to even discuss that?
Okay. Um, Okay, I'm going to take about a good few minutes to respond to it. Currently, we do not have the two types of vaccines which are available globally for prevention of cervical cancer. One is called Gardasil and the other is Cervarix. So currently, there is no availability of the vaccine in the country. In the past, a number of sessions or um, talks have been arranged over the years, and they have not only been arranged in the most affluent parts of the country but also in certain low socioeconomic areas as well. The response from both sides has been equally, I would say, not very, the impression was they're not very keen. There were reservations from the cultural point of view because remember, having a vaccine, the age group that is targeted for vaccine is females or even males in the ages of 12 and 13 years. Now that's a school going age. So
Mhm.
the main reservation to the parents was, oh, we are not exposing our children to such an information.
Yeah.
I understand their concerns as well, but I think we need to be more realistic. Um, there are things happening in the country. Then eh, there's a lot of evidence indicating the number of cases of STDs are increasing. The HIV is on the rise. So one day, sooner rather than later, we will have to face with the dilemma of a rise of cervical cancer. Currently, its prevalence isn't that much in the country, but in the future, it is likely to increase based on the reasons I've just explained. So I think we have to be very clear that the purpose of a certain information being released in the schools and colleges is for the safety of the female rather than to be used for any other purposes. So we have to be very, very clear, explicit in delivering such talks, in giving information leaflets to parents, to children, because before we need to vaccinate these children, we need the consent from the parents. So they need to be in agreement with us. We will not be able to proceed, obviously, because you have to deal with a minor. So that is where some of the barriers again are we are faced with.
I think it is challenging, especially in conservative
Yeah.
society like Pakistan, to convince parents to vaccinate their children against cancer, or against a vaccine which is related to sexually transmitted diseases also. Um, so, could you walk us through how you explain cervical cancer screening results to the patients? So, when once you have the results, so how do you communicate those, and especially in the cultural sensitive society of Pakistan.
Okay. So when we get the results of a cervical screening, a female who has consented to undergo the screening process. So once the procedure is done, for instance, things like a pap smear or colposcopy, once we have examined, taken the cells has been examined under the microscope. It comes into three categories: the CIN 1, 2, and 3. So CIN stands for cervical intraepithelial neoplasia. Uh, so CIN 1 means that when you look at the thickness of the epithelium, only one third of the cervical epithelium is affected. So
Yeah.
that's low, less severe, least severe. The CIN 2 and 3 is when two-third or more than two-third of the epithelium is affected. That becomes a bit more, we have to be more cautious about it, because the patient then needs the surveillance again. She needs to be checked after a while and treated. So that is a case of a referral. So if the general practitioners are aware of interpretation of the results of screening and what to do next or advise the patient next is best dealt with. Once the basement membrane, which is the layer, if that is breached, then obviously the cancer develops. But as I said earlier, the CIN 1, 2, and 3, these changes in the cells take years to develop. So if somebody is picked up in the CIN1 stage, we have plenty of time to kind of deal with them, advise them, looking at their risk factors, if there are any triggers. For instance, if she's a smoker, we can ask her not to smoke. If somebody is in the profession of like prostitutes, where they have to deal with multiple sexual partners, then we can advise them about that, or signpost them towards a vaccine if it's available. So these are some of the things we can do.
Okay. So, if you can implement one major change to improve cervical cancer outcomes in South Asia, what would that be?
I think it would be screening
Mm-hmm.
and more awareness. Whenever you make the relevant set of people more aware,
Yeah.
that is where you see positive outcomes in that area. Um, and I'll give you a small example. Misuse or reuse of needles. If you make the population aware that this is happening and they report it on a helpline, then empowering the masses actually helps. So, but in this particular aspect, I think empowering the primary care physicians who are working in the communities along with the population. So two cadres have to be made aware or educated about these things, and then that would certainly promote screening when patients come and ask for it. Oh, I've got symptoms, I'm worried, um, so on and so forth. I had so many children. I had child at a very early stage, and I read in your leaflet that I'm at risk. So what do you advise me? So more people asking questions, more physicians will be looking for answers. Put it that way.
Yeah. So one of the things, coming back to vaccination again, the boys and the girls both have to be vaccinated at the same age, 12 to 13 onwards. Um, Even in Australia, I know when boys are asked to, or you suggest vaccination to the boys, there is quite huge resistance because cervical cancer appears in females, and most of the boys in that age they will question why do we get to get vaccinated? It's not related to us. So, what is your opinion on that? And
I think
how do you deal uh, when you're talking about vaccination in societies like Pakistan and South Asia?
Okay, so I think it's important to make the population who we are targeting for vaccines, like boys and girls in a certain age group, is the vaccine protects you against the human papilloma virus, right?
Mhm.
So because of the way it is transmitted, uh, cervical cancer is of various types, okay, but more than 95% of the type that is caused by human papillomavirus. So the topmost cause. So protecting yourself uh, against a virus will protect the development of a cancer. So I can see where their questions are coming from, but this is the way to answer is we are reducing the transmission of the virus by giving them vaccine.
So, if a person, for instance, in countries like Pakistan and in many South Asian countries, this
Mhm.
vaccination was not available before, and right now you're saying that both of the vaccines are not available. So, what happens if you don't vaccinate children 12 to 13 or up until their 20s? Is there any use in girls and boys who are not sexually active to be vaccinated?
Okay. Some of our patients decline cervical screening because they say they are not sexually active.
Mm-hmm.
Okay. So yes, that argument is okay. We accept that, and it's the patient's autonomy at the end of the day. Um, and there was a discussion on one of the groups earlier. Should the cases of rape or sexual assault be also included in the cervical screening for HPV virus? So again, that answers the question that you've just raised. Maybe we are trying to, by screening a larger population and everybody, maybe we are trying to be over careful, but from our end we are not trying to miss anybody, and not anybody who falls off the radar and say, oh, because we were not covering this population, or we were not offering to everybody, this certain group has been missed. So it's a difficult conversation. It's challenging. It has to be two-way, and it has to be backed up by evidence and information leaflet. And it's a conversation or a decision that you're not going to achieve in one sitting. So patient may need a follow-up to discuss this as well. Yeah.
Thank you, Dr. Hina. So if you the test come back and then you look at and then you think that this person or this uh, woman is either has cervical cancer or is in earlier stages, what do you do then as a GP?
Right. If it's an earlier stage of cervical cancer, and if the cancer has spread to other parts of the body, because if you look at, as we discussed earlier, the anatomy, if it's in close proximity, so there is a primary tumor where the basement membrane has been breached, and it has involved the full thickness of the epithelium, and it has gone beyond the serosa, which is the outer layer um, uh, of the epithelium, into the rectum or
Mhm.
anteriorly into the bladder. Then patient comes with more signs and symptoms associated with it, including the pain, bleeding from any of these tracts. If it spreads beyond into the local pelvic area and further up into the liver or into the bones, then obviously the symptoms are different. Patient then goes into a phase which is called palliative, and all we have to do is make their life as comfortable as possible. So they may not be the candidate for the radiotherapy or the chemotherapy. They may be only receiving the treatment for their symptoms to keep their life as painless as possible. Now, before we go into that avenue to decide who's palliative and who's not, there is a set of investigation that needs doing. For instance, CT scan, MRI, visit to oncologist, visit to a gynecologist for full examination, identifying what type of cancer it is and what can, if anything, can be offered. So it depends on the size of the lesion, um, and if it has involves a larger area locally or widely into the body. Yeah.
So the role of the GP is to refer these patients to the appropriate facilities.
Yeah, I mean, because as a GP, we if a person presents at a later stage, and we feel that after examining the patient, so we take the history, we examine the patient. In the examination, we look at the abdomen. If in any internal examination that is needed, we make them undergo some of the tests like blood test or ultrasound, and then refer them for a CT if we are suspecting it. So these are some of the things we do. We make them explain that these are our suspicion. We may be wrong, but we need to investigate further. You may need to be referred to the hospital for various things like radiology, oncologist, surgeon, gynecologist. You may need treatment like chemotherapy, radiotherapy, surgery. So a broad generalized conversation can take place. So just give patient an idea what to expect. But again, don't give too much information. Patient can get scared. So if you're not sure, say you're not sure and
Okay.
and then for
So
investigation.
is there any role of GP after that? So once the patient goes to specialized care, come back to, is there any role of the GP after that?
Yes, I think in terms of communicating, speaking to the patient, how they are managing, if they are needing any assistance, the family who's looking after them. So that social support, that primary care support, the follow-up, any communications that need to be conveyed to the secondary care, because patients may not be able to know the symptoms that they are undergoing is something that they are aware of because they haven't experienced it. Connecting them to people who already have experienced cancer or the families. So, because you need that peer support at that time. At times, patients feel they are the only one experiencing it. So, it's best to connect them to the wider world who have gone through it. So, primary care physician can be that point of contact for the patient, the carers, and any other similar group of people who have experienced it. Even hospital doctors can signpost to such groups. There are not many, depending on where you are. Larger cities, you may find somebody, but in smaller places, it may be difficult to find. So it's tough to get answers to all the queries, but at least we can try and help them and find out. Yeah.
All right. So one last question. If there is any success story that you have which can illustrate the impact of early detection,
Impact of
early detection.
early detection. In Pakistan, unfortunately, no, I haven't got any. There are not many females who have undergone cervical screening that I've come across. I haven't got like a statistical data with me, but remembering on top of my head, in the past years, I do not think many number of females have. When you have asked them, have you undergone screening, then
Yeah, it's difficult
no,
because women
the
do
answer
not.
is no.
Yeah, yeah.
But in West where I work, yes, there are plenty of cases where CIN 2, 3 cases have been dealt with successfully. The purpose of the screening is to ensure you catch it early. So that purpose is lost if the screening isn't there, basically, and then you're just sitting on a time bomb waiting for it to explode.
Yeah. Thank you very much. I think we've covered all our questions. Just one last question with a last comment. If there is anything that you want to add to whatever we've discussed, if you think that we've missed something, so please let us know.
Okay, I think the cervical cancer month was January. Every year, January is dedicated as cervical cancer awareness month. I know we are in February at the moment, but obviously the awareness can continue. My message to all the listeners would be, as a practicing general practitioners, make sure you are aware of all the cancer screening types that are available, and any patient you feel who's affording, because these are costly, they are not free of cost, but in certain centers they are available at very low cost or free of cost, particularly in public sector. So just ensure you've got a list of all those hospitals where you can refer your patients according to their affordability. And regardless of that, make every patient aware, particularly those mothers who have got children in the school age group. Make them aware. If you can visit your local school and talk to the teachers and the parents. So use any opportunity you can to spread information about it. And you never know when that day will come when more people will be aware of it.
Is there any national program that is to raise awareness among the masses in Pakistan?
About cancer, cervical
Cervical,
cancer.
cervical cancer.
Uh, Not that I'm aware of, but certain individual hospitals are doing some amazing work.
Mhm.
Uh, but it's at a local level, and at times the local general practitioners are not even aware of it.
Um,
But that is why networking is more important. It's very important to know the places around you where you're based, so you can use that as an information to inform your patients. Yeah.
Thank you very much, Dr. Hina. I learned a lot during this discussion, and I think it's a very important topic. And it's great that you are handling that and spreading awareness about cervical cancer. Thank you very much. We'll
You're
meet
welcome.
again pretty soon. Thank you.
Thank you.